You feel it when you're nervous or hot, the flush on the skin, moisture prickling at your temple or palms, rivers of sweat running down your body. Sweat is a necessary bodily function. It keeps us cool and prevents us from overheating. It's natural if you're playing a game of pickup at the park. But what if you're not in danger of heat? What if you're just lying around in an air-conditioned room and there's no impending stressor, medical condition, or medication side effect triggering that sweat flow? Then you may suffer from a condition called primary focal hyperhidrosis.
Hyperhidrosis is excessive sweating. There's no way of numerically quantifying that, but sweating to the degree that it bothers a patient. We don't know the causes of it. It is presumed to be something that's genetic. I have families where parents and children both suffer from this.
Many hyperhidrosis patients sweat excessively from one or two areas, usually the palms, feet, underarms, or face. However, there is a small percentage of patients that suffer hyperhidrosis all over. If you've ever broken into a sweat at an inopportune time, when you're talking with someone you want to impress, or when delivering an important presentation, then you know how embarrassing it can be to feel that little trickle of sweat. So you can imagine how excessive sweating can interfere with everyday activities.
Unfortunately, patients are very embarrassed by this condition, so many patients don't even bring it up. So I think it's important that patients realize that they're not alone. It's estimated that about 5% of the US population is truly hyperhidrotic, where they're soaking through their clothes, and countless patients who are sweat bothered. So if you don't bring it up with your doctor, you're not going to get adequate treatment. So it's something you should feel comfortable discussing with your doctor or dermatologist.
A diagnosis is made based on patient history, and there are many treatment options available.
Antiperspirants, and then you get into the clinical strength antiperspirants, which have a higher percentage of aluminum chloride or similar substance. Then there are prescription antiperspirants, which have even a higher concentration. And in some patients, this will work. The drawbacks to these are irritation. Many patients get very irritated from the high concentrations of chemicals that are being applied. But for some patients, that works, and they're very happy with that.
There are oral medications available, but they can have side effects such as dry eyes and dry mouth, so they're not very popular. However, they can be effective.
In the past, we used to use a lot of Botox injections for underarm sweating. Botox injections are highly effective for underarm sweating. Last for about 3 to 6 months, so it's something that you need to keep repeating. And then you get into more aggressive treatments. In the past, there's patients who actually had their sweat glands removed surgically, and then there was a procedure where they could actually clamp off the nerves that innervate the armpits. Now, obviously, these were not popular procedures ever, and with Mira-Dry, I think they're probably going to fall by the wayside.
Mira-Dry is a relatively new technology that provides a permanent cure for excessive sweating.
Well, it uses precise amounts of energy delivered in multiple applications to each armpit, and the energy is high enough to destroy the sweat glands. And we know that once sweat glands are destroyed, they don't regenerate, so they are gone forever, and the sweating problem is cured in 1 to 2 sessions, depending on the degree of sweating that the patient initially had.
If you've struggled with excessive sweating, then it might seem impossible to imagine a world in which you don't have to bring a change of clothes to work, or you can confidently shake hands with a stranger. But maybe after a chat with your doctor, a sweat-free world can become a reality. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.